Hello everyone, my name is Ben MacNevin from Montgomery Investment Management. I thought this video insight would be an ideal opportunity to provide a bit of show and tell on the current and projected state of Australia's healthcare system, given how much is being said between healthcare providers, funders and the government in the public eye. Now, many of you would be aware of the increasing age of our population, but here is how it is projected from the government's Intergenerational Report. As you can see, the growth rate of the population aged 65 and over is projected to be significantly higher than the overall population growth in coming decades. Now, what's critical about this dynamic is that the healthcare costs increase significantly for people aged over 65 years. As you can see from the chart displayed, the Australian government is paying around 5 times more on average for individuals in the later stages of life. So on a real basis, the cost per person is expected to increase materially in the coming decades. But where are the costs concentrated in the system? Well, from the government's 2014 report on Australian health expenditure, public hospitals comprise the greatest share of health expenditure, far more than private hospitals, dental services, and the pharmaceutical benefits scheme. Now, none of the parties in the healthcare system want to compromise the standard of care, but you can start to appreciate why the government's dialogue is shifting to the effectiveness of healthcare spending. Basically, they want to keep patients out of public hospitals. This means a greater share of primary healthcare centres, treatments in the home, and stronger levels of private health insurance membership. So against this backdrop, what are the key takeaways for investors when identifying opportunities and threats? Well, first, rising volumes does not equate to rising profitability. If the primary funders are seeking to contain price inflation, companies with cost bases that are highly labour intensive may experience margin pressure as wages of the healthcare professionals are likely to increase. Second, scale is becoming increasingly important for returns as providers become more reliant on individual funders. Medibank Private's recent public scout with Calvary Hospitals is a case in point. Third, funders are pushing for greater insights and data integration with providers to ensure that what is being reimbursed is comparable to the value provided. Investors must critically understand the value provided by healthcare companies, because unless they're taking significant costs out of the system or providing a product or service that warrants a premium price, it's increasingly likely that the funders will identify and contain areas of excess. So that's the tip of the iceberg for this week. Thank you for joining us. If you've got any questions, please leave them in the comments. Otherwise, please follow us on Facebook and Twitter.